Hey guys, Dr. Lera here at Heron Animal Hospital. If you haven't met me before or watched any of my content, I'm a veterinarian in South Florida and I've been doing this for about 17 years. I do consider myself a hybrid hippie. What is that? So I use AI to go ahead and help me be more efficient and to do some research and help me with some projects. The same token, I will turn off my phone, put it away from me, put it on airplane mode, and I give my dogs raw food and I don't like giving a lot of vaccines. That being said, the video for today, I'm going to be talking about ear medications and if your dog has a ruptured eardrum. The patient for today is going to be Bentley. He's an adorable dog, but he does not like being here. So he came in on Friday last week because he all of a sudden was not feeling well. He had a little bit of a head tilt, and earlier in the week he had come in for an ear infection. We started him on some ear drops 2 days before he had come in. And when mom and dad were reporting what they were seeing to me, I automatically thought, it sounds like he has a ruptured eardrum. Now, why does that matter? So, ruptured eardrums, this part right here is the eardrum, and then usually this part of the ear is where all of the majority of the infections happen. Now, you can imagine that for me to see this part right here, it's going to be a little challenging for me to stick an instrument or straighten out the ear canal to be able to see the eardrum, especially when patients have ear infections, because the ear is inflamed and uncomfortable. That being said, if the eardrum is not intact, meaning that there is a hole in the ear as a result of the infection, usually what will happen is these are the inner parts, the middle and inner parts of the ear. And that is where the balance system, we call it the vestibular system, is held. When that medication comes in, 95 to 98% of ear medications will cause what we call ototoxicity. See this like twitching of the eyes, we call it nystagmus. We'll also see a little bit of a head tilt. You'll see them become nauseous maybe and even lethargic, and they don't want to eat. That is typically tied to the fact that they're having that ototoxicity. If you see that in your dog, please, please, please stop the drops immediately, call your veterinarian, and what you'll probably have to do is you'll have to go ahead and just discontinue that, maybe look at switching medications for the future. This is most likely a temporary problem. Sometimes it can be a permanent problem, but usually just temporary. This is actually the third patient that I see that has this issue, and within 24 hours of stopping the meds, he got better. So I hope you guys found this video helpful. If you did, please like, subscribe, and share. If you have questions about this topic or any other topic, you could always hit us with the word clone, and we'll send you a link for a little digital mini Dr. Lera that you can have access to from the convenience of your pocket, the comfort of your home, all for free. Thanks for watching, and have a blessed day.